Hey there, thanks for tuning in. Whether you're a medical student, a healthcare professional, or just someone curious about spinal health, you're in the right place. Today, we're going to break down a complex but important topic in neurology, Tethered Spinal Cord Syndrome, or TCS for short. This is a condition that's not only relevant for exams, but also for real-life clinical practice, especially if you're planning to work with children or adults who have neurological symptoms. So, let's get started and make sense of TCS together. Today, I'm diving deep into Tethered Spinal Cord Syndrome, TCS, something you'll definitely encounter as a medical student. It's a topic that bridges anatomy, neurology, pediatrics, and even rehabilitation medicine. Understanding it can help you recognize subtle signs early, which can make a huge difference in a patient's life. So what's TCS? It's when the spinal cord gets stuck or anchored inside the spine, so it can't move freely. Normally, the spinal cord should hang loose within the spinal canal, moving up and down as we bend and stretch. But in TCS, something tethers it, like a band or a piece of tissue, so it's pulled tight, especially as a child grows or as the spine moves. This abnormal anchoring creates constant tension on the spinal cord and its delicate nerves. Over time, this tension can stretch and damage the nerves, leading to a wide range of neurological symptoms. The effects can be subtle at first, but they often get worse if the tether isn't released. That constant tension can stretch nerves, leading to a host of neurological symptoms. These symptoms can affect movement, sensation, and even the function of organs like the bladder and bowel. The tricky part is that symptoms can vary a lot from person to person, and sometimes they're mistaken for other conditions. Now, let's talk causes. TCS can be congenital, think spina bifida, lipomas, or other birth defects that affect the spine and spinal cord. In these cases, the problem is present from birth, and the tethering is often due to abnormal tissue or fat deposits that anchor the cord. Another common congenital cause is a thickened filum terminale, the thin thread of tissue at the end of the spinal cord. If this filum is too thick or tight, it can act like a leash, preventing the cord from moving as it should. But TCS isn't always something you're born with. It can also be acquired later in life. For example, scar tissue from previous spinal surgery, trauma to the back, tumors growing near the spinal cord, or even infections that cause inflammation can all lead to tethering. These acquired cases can show up at any age, and sometimes the symptoms appear years after the original injury or surgery. The timing and severity of symptoms often depend on when the tethering occurs and how much tension is placed on the spinal cord. In children, the problem can worsen as they grow, since the spinal column lengthens, but the cord can't move freely. Symptoms? They're sneaky and depend on the patient's age. Kids might show delayed motor milestones, odd walking patterns, or foot deformities. You might notice a child who struggles to keep up with peers, has trouble running, or walks on their toes. Sometimes, there are visible signs on the lower back, like a dimple, a patch of hair, or a small lump. These can be clues that something's not right underneath the skin. Teens and adults can have back pain, leg weakness, or numbness, even scoliosis. They might complain of tingling, burning, or shooting pains down the legs. Some people develop muscle wasting, foot drop, or changes in the way they walk. Scoliosis, or curvature of the spine, can sometimes be the first sign in older kids or adults. And a big red flag, anyone with bladder or bowel problems needs urgent attention. Loss of control, frequent infections, or difficulty urinating can all point to nerve involvement. These symptoms mean the spinal cord is under serious stress, and quick action is needed to prevent permanent damage. How do I diagnose it? MRI is the gold standard. It gives a detailed view of the spinal cord, showing exactly where and how it's tethered. MRI can also reveal associated problems, like lipomas or other abnormalities, that might be causing the tethering. But in infants, I might use spinal ultrasound. This is a safe, non-invasive way to look at the spinal cord in babies whose bones haven't fully hardened yet. It's especially useful for screening newborns with skin markers or other risk factors. Neurological exams and sometimes CT scans can help round out the picture. A thorough physical exam can reveal subtle weakness, changes in reflexes, or sensory loss. CT scans are less common, but can be helpful if there's a question about bone abnormalities or previous surgeries. As for treatment, surgical untethering is the mainstay. The goal is to release the spinal cord so it can move freely again, relieving tension and preventing further nerve damage. Surgery is delicate and requires a skilled neurosurgeon, but it can dramatically improve symptoms and quality of life. Recovery? Physical therapy is key for regaining strength and movement. Rehab helps patients relearn motor skills, improve balance, and build muscle. It's a team effort involving physiotherapists, occupational therapists, and sometimes speech therapists if there are related issues. And I always remind patients, lifelong monitoring is crucial since retethering can happen. Regular checkups, imaging, and ongoing therapy help catch problems early and keep patients on track. Education is also vital, so families know what signs to watch for and when to seek help. The earlier we catch and treat TCS, the better the outcome. Early intervention can prevent irreversible nerve damage and help children reach their full potential. Even in adults, timely treatment can stop progression and improve function. Delays can mean permanent damage. That's why awareness among healthcare professionals, parents, and even teachers is so important. Recognizing the warning signs and acting quickly can change the course of someone's life. And as a future physio, you're on the front line, spotting red flag symptoms, guiding rehab, educating families, and supporting patients through every stage of recovery. Your role is vital in helping patients regain independence and confidence. You'll also help prevent complications by encouraging regular follow-ups, teaching safe movement strategies, and promoting healthy habits. Your support can make a world of difference for patients and their families. So remember, TCS is serious, but with awareness and action, we can make a real difference. By working together, staying informed, and acting early, we can help patients live healthier, fuller lives. Thanks for watching, and keep learning.